In an effort to prevent the transmission and spread of COVID-19 in St. Lucia, the government has ensured the establishment of quarantine facilities. As of March 31, 2020, the Chief Medical Officer, Dr. Sharon Belma-George, made note that St. Lucia has over 300 people in quarantine, including both home-based and facility-based. Dr. Belma-George spoke on the need to routinely monitor people at the quarantine facilities in the event they show signs and symptoms of COVID-19.
When we just started, because the areas of risk were limited and the number of persons coming in, we were able to facilitate quarantine through home quarantine, and we had an arrangement with a guest house for those who did not have the facilities for home quarantine. As COVID-19 progressed and more areas became high risk and even our travel restriction list was extended, there was a need to utilize hotels to be able to have the capacity to manage the increased numbers. So we have 3 quarantine facilities, 2 in the north and 1 in Castries.
The Chief Medical Officer also spoke on the conditions at the various quarantine facilities.
During quarantine, there are certain basic conditions that the quarantine authority has to ensure is provided. It has to be a safe area. Also, the state has to ensure that they are provided with food, their meals on a regular basis, water on a regular basis, and we ensure that their medical needs are met. We have a wide range of persons under quarantine with different health needs, so we ensure we've had to set up a small clinic in each of those facilities to ensure that they get their medication and all of their needs are met.
The Department of Health and Wellness also ensures that people in quarantine are provided with psychosocial support. The recommended duration of quarantine for COVID-19 is 14 days. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fenel Neptune.